Well, hey guys, in today's video, I wanted to talk with you guys about seborrheic dermatitis. It's been a while since we chatted about it. I know a lot of you cope with this condition, and honestly, moving into fall and winter, it's a time of the year where for a lot of people, their seborrheic dermatitis flares more often than like in the summertime, for example. So I thought now would be a good time to chit chat with you guys about it. What is seborrheic dermatitis? It is a chronic inflammatory skin condition that is actually basically the same thing as dandruff on your scalp. I think most people are familiar with that, but it affects the face. It actually can affect really any body site. Predominantly, it focuses in areas where you have a lot of oil glands. It's actually an oily skin condition. And in people with pale skin, it often presents with these red patches and a lot of flakes, flaky patches around the nose, around the mouth, in the eyebrows, in the beard area, anywhere where there are a lot of oil glands. In your face, there are a lot of oil glands. It's also really common in the ears, behind the ears. People who have deeper skin types, their seborrheic dermatitis actually can present as hypopigmented spots, or spots that are lighter in color than their background skin type. Don't worry, when the seborrheic dermatitis is well controlled, the color will come back. But like I said, it's related to dandruff, so you may also have dandruff in the scalp as well. And as a matter of fact, some of that dandruff can actually trickle down onto your face, it's thought, and cause the seb derm on your face as well. So it's a chronic thing, there's not a cure for it. And I'll tell you this, it's something that will flare with things that stress you out, emotional stress, being run down. If you get sick, people who have really tough and stubborn seb derm include people who have underlying medical conditions where they have immunodeficiency. For example, people who have HIV, and for whatever reason, people who have some underlying neurologic problems also have historically have worse seborrheic dermatitis. People who have conditions like epilepsy or Parkinson's, we don't really understand fully why that is. Perhaps it has something to do with the little nerves that innervate our skin and the neurochemicals that are released. And people who have those diseases, maybe they're more prone to having more neuroinflammatory mediators present in the skin that trigger the seb derm. Seb derm is also an inflammatory response to the little yeast that lives on our skin, Malassezia. And he's not bad. It's not something that people should try and obliterate or anything, but people who have seborrheic dermatitis, it's thought that their genetics are such that they have an abnormal kind of hyper-responsiveness to that yeast, and that's why they get these inflammatory skin lesions. And it's also related to oil production, oiliness. So anything that leads to increased oil production in the skin can worsen the seb derm. When we're stressed out, our stress hormones drive oiliness, aka seborrhea, and that can worsen this condition. Hormones, of course, the thing that we like to blame everything on, but hormones can certainly exacerbate this. So it can flare with hormones, and it can flare with hormonal therapies as well, like testosterone supplements, certain birth control pills. You may find that your skin is oilier, and if you suffer from seb derm, it's worse on the birth control pill. And around pregnancy as well, and then of course with the menstrual cycle. And in terms of helping the seborrheic dermatitis on your face, don't neglect your scalp. Even if you don't have obvious dandruff, I'm sure if you go scouting through your hairline, you'll find some patches of dandruff. And so it's just a good idea to stay on top of your scalp hygiene. Shampooing your scalp is one of the best things that you can do to help control the seborrhea on your face, because like I said at the intro, some of that dandruff, even if you don't note obvious dandruff, some of the dandruff and the flakes from your scalp can trickle down into your face and exacerbate this further. So the scalp hygiene is a major piece that you might be missing. But there are many active ingredients that can help control the seborrheic dermatitis. The first active ingredient is one that you'll find in shampoos for the scalp and in numerous products, both cleansers and leave-on products for the face, and that is salicylic acid. This is a great ingredient for people to use. You can honestly use it daily, and you can use a variety of forms for both the face and the scalp. For the scalp, Neutrogena makes a salicylic acid shampoo, Neutrogena T-Sal. It's fantastic, it's fragrance free. But the way to use a salicylic acid shampoo is to just lather it to the scalp, let it sit on there for a few minutes, and then rinse it out. Now you can do this every day if you're somebody who can tolerate shampooing your hair daily. You can do it every day in the setting of a flare, and then back off once things get under control to maybe once a week. And a lot of people have to shampoo their hair, can't shampoo their hair more than once a week. So when you do your shampoo, incorporate a salicylic acid shampoo into at least the scalp piece of that, and that can really help. Neutrogena also makes a salicylic acid face wash that it's marketed for people with acne, but it can help the seborrheic dermatitis on the face a lot. And you can honestly use that up to twice a day to help control the seborrhea on the face. You can just lather it exclusively to the areas that are most affected. So some people, they just have sebderm around their nose. You can just lather it to that area. You don't need to use it all over the face. It makes it last longer. Leave it on the skin for a few minutes and then rinse it off. And like I said, you can use that up to twice a day. And in setting of a flare, you can use it daily. And then maybe you might want to back off to using it every day, once a day, or every other day, depending on how your sebderm goes. Everybody's sebderm is individualized, so it's not a one-size-fits-all approach. You also can use a salicylic acid leave-on product. This is a great choice for your face, and my favorite salicylic acid leave-on product is the Paula's Choice 2% BHA liquid exfoliant. This is a great option for sebderm on the face. It helps control oiliness, and it really can help calm down some of that inflammation because salicylic acid is actually anti-inflammatory. Now, another product I wanted to share with you guys for the scalp is for people especially who can't really shampoo their hair that frequently. This is a great option. It's new to me and I've been trying it out for several weeks now. It's by the Inky List, and you guys know I love the Inky List. It's their salicylic acid, what is it called? Exfoliating scalp treatment. This is just a liquid that you could put a few drops in your hand and massage it into your scalp. You leave it on the scalp for 10 minutes, and then when you get in the shower, you rinse it out. You do want to rinse this out after the 10 minutes. So this is a good option for people who find that most salicylic acid shampoos are too drying for their hair. This, removes the shampoo piece of it, and you're just getting the salicylic acid, almost like a toner or something, a mask. And just massage it in, leave it on for 10 minutes, and then rinse it off. I will say this though, be very careful when you're rinsing this out. Tip your head back and let the water, rinse it out from behind. You don't want it to run into your eyes. I made that mistake and it burns if it gets in the eyes like the dickens. So be very careful. But this is quite good and it will help lift up those scales. I think they say to use this 1 to 2 times a week, but you could actually use it more frequently than that. Yeah, I really like this. It's a good option. Try it out. And they also make a good salicylic acid face wash as well. That's fragrance free. And the Inky List is cruelty free. So that's an option for you guys. That and the Paula's Choice are options for you guys who want cruelty free only. The next ingredient is Zincpyrithione. Zincpyrithione helps calm down that little Malassezia critter. And that's what you're gonna find in anti-dandruff shampoos. You're gonna find Zincpyrithione in Head & Shoulders and the generic versions of Head & Shoulders in the pharmacy. And it's a great ingredient for this. You do need to lather it to the scalp, or in the case of the shampoo, you can lather it to your face and use it as a face wash. Just lather it to the affected areas, leave it on the skin for a few minutes to allow that Zincpyrithione to go to work, and then rinse it off. Now, the shampoos tend to be on the more drying side, especially for people with textured hair. But Head & Shoulders actually came out with some recently that have more moisturizers added. So definitely try that out if you have more textured hair and you've had a bad experience with Head & Shoulders for your hair type in the past. I do think the newer formulations with more moisturizing emollients, I think they are a nicer option. But I want to give a shout out to a great Zincpyrithione facial product that you guys do not sleep on this if you have seborrheic dermatitis, because I find it to be one of the most effective over-the-counter products for seb derm, and that is the Vanicream Z Bar. This is a fantastic bar soap for washing your face, and it works really well for seborrheic dermatitis. It's also really helpful if you have rosacea or acne, because Zincpyrithione is anti-inflammatory and can really help calm down those conditions. But this particular soap, it's not drying. It doesn't have harsh surfactants in it to strip the skin barrier. It's really good. So I highly recommend that for facial seborrheic dermatitis. Now you may be wondering as we go through these ingredients, which one is better, and there's really not a better, best ingredient. But you might find that you benefit the most from combining a few of these things. So say for example, you use a salicylic acid leave-on product on the face, and you also wash your face with a Zincpyrithione shampoo or the bar soap. You may find that you need to change ingredients around. Each ingredient kind of has a slightly different mechanism of action in helping the seborrheic dermatitis, so you often can get better results using a combination of ingredients, kind of alternating them around and using different forms like cleanser versus leave-on. One day, hopefully, we'll figure out, more of a tailored, individualized approach to figuring out which ingredients work best for people. As it stands now, I feel as though it's a bit hit or miss, trial and error when it comes to figuring out what works best for you. No one patient and one person with seb derm, responds to these ingredients the same. The third ingredient is selenium sulfide. Now this is also really good for calming down that malassezia and inflammation. It's what's in Selsun Blue shampoo, and Head & Shoulders Clinical is also a selenium sulfide shampoo. So just like the Zincpyrithione shampoo, same thing with the selenium sulfide. Just go ahead and lather it to the affected area, either on your face or your scalp. Let it sit on there for a few minutes and then rinse it off. And with this, the frequency with which you use it, you can do it daily, every other day. If you're in the midst of a flare though, you really want to amp up the frequency to daily. And then last but not least, I have a video on this bad boy, but it really can be a game changer for people, and that is Ketoconazole. And over the counter, that's gonna come in the form of Nizoral shampoo. Again, use it the same way that you would use the Zincpyrithione shampoo or the selenium sulfide shampoo. Just lather it to the affected areas, leave it on the skin for a few minutes, and then rinse it off. And any of these shampoos, you can use them daily, especially in the midst of a flare. I think that's really where you want to amp it up to daily use, either in the scalp and or on the face. But for maintenance, you can use these a few times a week, the shampoos, to your scalp. That will help give you control of the facial seb derm long-term as well. And you can also use them like once a week on your face as like a face mask. In terms of your skincare when it comes to seborrheic dermatitis, don't skip out on sunscreen. The other thing that can be really helpful is to just use a basic moisturizer at nighttime. Another piece of seborrheic dermatitis is a skin barrier issue, and that can be helped with consistent use of a moisturizer. And a lot of moisturizers have good ingredients in them for calming down that redness aspect of the seb derm. And one you guys have heard me recommend numerous times is the Cetaphil Redness Relieving Night Moisturizer. Anyways, this product has niacinamide, licorice root, and caffeine, all of which will help reduce redness. Those are my recommendations for products for seborrheic dermatitis. But honestly, you guys, a lot of seborrheic dermatitis in terms of products is personal trial and error. And honestly, a lot of people do end up needing prescription medications, topical medications. A lot of people might end up using a prescription topical steroid. I have had to prescribe those for patients for use on the face who have pretty stubborn seb derm, and it helps, a short trial of that. So, your derm can help out with that if it's really unresponsive to these over-the-counter things. Also, a topical medication called pimecrolimus or tacrolimus Protopic. These medications are steroid sparing, so they don't come with the side effects that steroids can have. So they're a safer option for the face long term. So that's another option. Unfortunately, at least here in the States, getting insurance to approve them can be a battle, and they are expensive, but they are a good option. And then another ingredient that really can help, and then lastly, another medication that can really help sebderm a lot, that's by prescription only, is sodium sulfacetamide. This can come in the form of like a leave-on lotion or a wash. It goes by the brand name Avar. It can be quite helpful for controlling the sebderm, especially when the over-the-counter stuff is not quite cutting it. And I mentioned Ketoconazole, you get that over the counter as a shampoo, but there's also a prescription cream that can be prescribed that can help as well. So those are my sebderm pearls, tips, whatever you want to call it, and the products that I would recommend, the ingredients. I'll list all of these down below for you guys. But for those of you with sebderm, comment below, how is it going? Share your experience. I think that really helps people to build a sense of community in the comments, and share things like what worsens it for you and how you incorporate these ingredients to manage it. I think that can be really helpful for people, especially people who maybe are dealing with this for the first time. But it is a very common skin issue, so there's a good chance that you've dealt with it at least sometime in your life. I hope these tips were helpful. If so, give this video a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.